That brings us to the communication piece. And this has also changed the paradigm for us as medical oncologists. Don't you think, Coral? Like, how do we get
Absolutely.
patients to see medical oncology earlier? And how do we say the same message, right? So that patients can understand and value sort of the importance of biomarker testing, waiting for that, and then planning for a neoadjuvant or perioperative strategy. We can only do that if like the surgeon is on board with us, Red Onc is on board, that this will be the best strategy to identify which patients are going to be truly resectable. Coral, how has that been in your own practice, and what is your
Yeah,
view on that?
you actually picked my brain because I was just thinking when I was talking about like having to do the whole workups and then for staging and repeat bronch and MRI brain, PET CT, T in the CT surgeon patients a lot of times are like, listen, doc, like I've been waiting for too long. I want this to get over with. And I don't know if this is the same for all patients, but my patients just want to go straight to surgery. Us Hispanics, like you just take it out, remove it, and the problem is done, and just we move along. So it's really like a lot of education, a lot of like conversations, and really having them involved in the decision making and the treatment plan. One thing that we do in our group that we try to do with most of our patients is not only does whoever sees the patient first brings it up to tumor board discussions, so that way we can tweak them with CT surgery, med-onc, and even rad-onc. But also a decision is made into like, okay, after tumor board, when we discuss this case, we're gonna meet in a virtual multidisciplinary visit with all of us combined to make sure that all of us kind of like say our piece, and so that we look also like a comprehensive, cohesive group, and that's like a full decision that we all are in agreement with. I think communication really is key, not only with patients and caregivers, but also between ourselves. And you don't want to say one thing and then the surgeon says another thing, because that's where they lose trust. So I think that's really key in care. And I've noticed that patients are really receptive and open to things when they see that it's kind of like a combined group that's on the same page.
Right. Any other comments on that piece, Mara and Robert?
I was going to say, I would 100% echo what Coral said about the importance of us being kind of a united front. And I think that's really important, regardless of what our practice setting may be. Some of us, are fortunate to work like in a group practice setting where everyone of the different specialties all works together. That's not always the case. But regardless, it's not just about the goals of the providers, but also for the patients. They lose trust in the system, and they deserve to feel confident in the care that's being provided and to feel like it's a unified message. And if they lose confidence in the care path that they're receiving, it's not going to lead to good outcomes. And so I just really I love that you brought that up because I think it's super important.
Yeah, no, I echo those comments too. I think coordinated care is essential in the modern era. There's a lot of data to disseminate. We have to distill it down to an understandable way for patients and really communicate that, sometimes going straight to surgery is not the answer, and it doesn't provide you with the best chance for long-term survival. There's some other steps that we should consider. So it's important for us to, have coordinated message, coordinated care, and good communication with the patients. And also, I agree with, cutting down on the amount of time between when we first see the patient to we actually treat, because if they're seeing multiple providers, that could extend the treatment time or time to treatment. So the multiple disciplinary discussion early cuts down on that wait time, and patients are anxious to get started. So that does help cut down on the time to treatment.